So what makes naturopaths different than the other doctors? Namely, it's the principles and the treatments that we use. The primary principles, there's about 6 of them. Start with the healing power of nature, or the vis medicatrix naturae, which Hippocrates talked about. Number 2, identify and treating the causes, tolle causam. First, do no harm. That's a big principle in naturopathic medicine. The doctor is teacher and the patient is co-learner, which has been practiced out here for several years. And treat the whole person, prevention, and wellness. So those are the principles that guide the practice of naturopathic medicine. And we'll break those down even further. With the healing power of nature, naturopathic medicine believes that there's an inherent self-organizing and healing process of living systems which establishes, maintains, and restores health. It's our role as naturopaths to support and facilitate this process by identifying any obstacles to health, removing those obstacles, and supporting the creation of a healthy internal and external environment. One of my favorite quotes when I was in chiropractic school was by Dr. Clarence Gonstead. He said, "Find it, fix it, then leave it alone. Let the body do it." Another principle is first do no harm. We try to utilize methods and substances which minimize the risk of harmful effects, and hopefully they have side benefits instead of side effects. So we usually try to apply the least force necessary when we're diagnosing and treating patients. The suppression of symptoms is usually avoided because suppression may interfere with the healing process. The original meaning of the word doctor is teacher. Physician was nature. So I guess naturopathic physicians are nature teachers. A principal objective of naturopathic medicine is to educate the patient and emphasize self-responsibility for health, which out here has been going on for quite a long time. We call the patients co-learners. We also recognize and employ the therapeutic potential of the doctor-patient relationship. If you come out here and you think that I'm a complete then I don't think it's going to be very healing, but if we can build a beneficial relationship, then I think that provides a better healing process. As far as treating the whole person, we believe that health and disease result from a complex of physical, mental, emotional, genetic, environmental, spiritual, social, and other factors. We recognize that health is multifactorial, and therefore often your recovery from an illness requires a multifactorial approach. We don't believe in the magic bullet approach. Naturopathic medical colleges emphasize the study of health as well as disease, and one of their primary things was to talk about prevention. We believe that the attainment of health in patients is a primary objective, and that it's accomplished through education and the promotion of healthy ways of living. Not only are we going to give you stuff to fight your illness, we're going to teach you ways to promote your health through healthy ways of living. Wellness is another principle of naturopathic medicine, and it's basically a frame of mind. We try to tell patients that being positive and having positive thoughts, emotions, and actions is better in your healing process than staying negative the whole time. It's an emotional state of the mind. Well, given those principles guide us in our therapeutics. So now we have the therapeutic order. In the therapeutic order, we start with the least invasive and move to more invasive therapies.